chosen topics. And if you remember, we've had a program last week which is related to women's health. It has been coming on these past 2 weeks. The previous was PID, and this last one was related to the 18 conditions that might be the causes of infertility in women. And today's topic is related to what we call the 18 conditions, which are the causes, or which could be the causes of infertilities in ladies. We've gone up to 7 different conditions that might lead to infertility, and we have promised to our listeners to keep giving more details about these disease conditions that can cause infertilities in ladies. But unfortunately today, being a public holiday, most of our collaborators who speaks the local languages, namely Fatu, Samba and Bailobari, are absent, and then it will only be done in English. Listeners who speaks or viewers who speaks Wolof will be here with us, but they can contribute by calling in Wolof. The answer can be given to them in Wolof, but you forgive me, I won't be able to elaborate more in Wolof and in Mandinka. I'll briefly just do and present this thing in English as we promise. As are the number you can call on to have access to Sathie Ramon Clinic directly, but the studio number will be given to you later, because like I said, we are still giving the possibility to ladies to call. So we have enumerated many diseases. Among those, we have what we call hormonal imbalance. Hormonal imbalance is another cause of infertility in ladies. Hormonal imbalance is when your ovaries, the hormones, let me put it this way, the eggs that are needed, the vitamins that are needed for you to get pregnant, for you to give birth to a child, to conceive and give birth to a child, are not produced naturally or equally, are not produced equally in a way that you might have some that are produced in a small quantity, while others are produced beyond the quantity that is needed. And hormonal imbalance can affect ladies generally when they are very close to menopause. But stress can also cause it and make a young lady to experience hormonal imbalance. Social stress, professional stress, domestic stress can make your wife to be having complication with the production of the hormones, and she won't be able to get pregnant while you are here with her or you are having regular contact with her. Hormonal imbalance are conditions that can be treated. It is very easy to control that, sometimes without medication, just with the change in your lifestyle, and your hormone production might be equilibrated. Medication are also available that can help ones to regulate the hormone production, because a young lady that is experiencing hormonal imbalance would sometimes not even be seeing her menses. The menstruation might not be coming. You might have young ladies that stays for 1, 2, 3 months sometimes without seeing their menses. It keep going and coming. Sometimes it comes even twice or 3 times within a month. All this might be signs and symptoms of hormonal imbalance. I repeat, stress, anxiety, depression can easily lead to that. So if you're a young woman who wants to have a child and you keep thinking you are having family stress, your family, both sides are oppressing or are disturbing morally, obviously it might minimize and reduce your chance to get pregnant. So it is important for one to support a lady who is in this condition, who wish to get pregnant, to help her not to be anxious, not to be worried, not to be depressed, because that will decrease the chances. We also have other causes of infertility in ladies, which are some tumors, which we commonly call fibroids and myoma and so on, tumors or cysts. The tumor are some masses that grows from the softened part of the womb. And the causes of fibroid today is unknown. medically. Why? Because it is not a disease on its own. It is a part of your womb, the part of your womb that is soft. Because when the ovaries produces eggs to enable your conception, for you to get pregnant, I mean, if you are not sexually active, or if you are not lucky to get pregnant within that time, probably your husband's sperm has a problem, or you have some other health issues like hormonal issues, the softened part will easily develop on its own and grow and to become a mass. That mass that is sometimes called fibroids or myoma, which sometimes needed to be operated to be taken out. We also have cysts. Cysts those are infections, inflammation, sexual transmittable infection in most cases that infect your tubes. And when the tubes get infected, they easily get inflamed, it gets swollen, and that could affect your menstruations, that could be causing serious stomach ache, vomiting, waist pain, constant urination, and also inability to get pregnant. Because if you are not ovulating well, obviously, because if your ovaries are swollen and infected, your ovulation will be affected. So once you are not ovulating well, obviously you won't be able to get pregnant. But the cyst can affect the two ovaries, while the cyst can also affect only one of the ovaries. And if it's only one of the ovaries that is affected, the lady can still get pregnant, because God has given two chances at two ovaries to ladies to get pregnant. So this being the case, it is important for one to know his or her health condition. It does no sense, there's no importance in you staying home, stressing, crying, looking for other possibilities to get pregnant without visiting a health personnel, a doctor, or an hospital where you can be treated, tested and treated to know the cause of it. Because before going deep into it, I want to make clear that causes of infertility in couples are not only the responsibilities of women. Women carries 60% of the responsibilities. This is what we are talking about today, but men also have the other part of the responsibilities which they are also carrying. So sometimes you might not be the cause, but if you are suffering from an infection, quickly get yourself treated before it gets out of hand, because we have a lot of teenagers who will be experiencing some infections, and they will not be telling their parents. They will also not be treating it until it gets serious, and whenever they get married, sometimes the case gets complicated and it affects their relationship, because so many marriages could not survive this condition. We also have what we call polypus in the uterus. These are also other complications that grows from the womb, and then in the form of also other masses which deform sometimes the womb and which will not allow ladies to get pregnant. Endometriosis are also other conditions. Endometriosis are conditions that can easily affect women at any age, being a teenager or somebody who is sexually active. Because during menstruation, the womb has some inner parts that comes out, that sheet from the uterus, but the lining attached outside of the womb can easily cause other complications, because it goes away and leaves the body, and that causes easy endometriosis and aggravates the ovulation system, and the menstruation can break, and some irregular bleeding might occur. So women with endometriosis in the world today cannot be counted, because that's one of the #1 causes of infertility. And sometimes it leads to tissues that grows from the womb, like fibroids, and causes bleeding, pain, serious discomfort, and then serious abnormality within the menstruation of ladies. And one of the main symptoms and signs of endometriosis are chronic or intermittent pain on the abdomen, on the lower abdominal part, irregular menstruation or painful menstruation, pain when having sexual intercourse, painful sexual intercourses, and then painful bowel when going to the toilet, difficulties passing stool is all part of endometriosis signs and symptoms. Fatigues, heavy and irregular bleeding, like I stated earlier, and pain during ovulation. Women have a day to ovulate. That's the 15th day from the menses, or 15 days before the next menses. That's the ovulation day, and that ovulation normally should be soft, and it should not be painful. But endometriosis can easily lead to a pain during ovulation, and constipation, diarrhea, and abdominal discomfort like epigastric pain and so on sometimes could also be the sign of endometriosis. And pain while passing urine, and lower back pain, that's the waist pain. So all these signs and symptoms should be taken in consideration by ladies who are in the age of giving birth, because this could be some of the signs and symptoms of the cause of your infertility. We also have what we call scares in the womb. You might be a young person who has been physically active, or who has had a very difficult childhood, who end up having some shock or some blow in the abdomen. You might fall, or you might be beaten, or you might undergo activities that might cause a scare or a wound or some malfunction in your womb. This could easily lead to infertility. Let me take the example of young ladies who will be pregnant and who always look for possibility or means to get rid of the pregnancies, which we call abortion. That's one of the reasons why abortion is one of the major causes of infertility, because when you get pregnant and you do an abortion, it can easily injure, damage, or deform your womb. And once the womb is deformed, automatically it changes in structures. So it might not be able to carry a pregnancy anymore, and that can lead to multiple miscarriages. So it is also to be taken in consideration that those who are sexually active and are not married and wish not to get pregnant, it's easy for you to be using contraceptive pills or get yourself protected to prevent unwanted pregnancies and sexual transmittable diseases if you're using condoms. Otherwise, if you keep doing abortion, your risk of dying is so close, and your risk of suffering infertility in the future will be very high than any other person. Callers who wish to call Star FM to take part in this program will be given chance to call later, because the telephone number will be given, which will communicate to you, so that you can call on later to participate on this program. We also have chronic medical conditions that can also lead to infertility. Diseases like sickle cells, diabetes, chronic health conditions can easily lead to infertility, and especially women who are not feeling well will have to consult a doctor, get themselves treated before thinking of getting pregnant, because being a pregnant woman, it also goes with responsibilities. So before you think of getting pregnant, you should make sure your health condition permits you to do so. These are the numbers you can call on later for this program at Star FM here. If you have questions, feel free to ask in Wolof or in Madinga. I think I should be able to give you the answer in those languages if I'm unable to communicate very well in that language. The telephone number, the official number of this radio station is 788-6966, 788-6966, or 9000966, 9000966. I repeat, 788-6966, 788-6966, or 9000966. These are Star FM number which you can call on to contribute, and then a chance will be given to you to ask questions related to your health condition. This program is useful to you being a man, because your wife can be affected, your sister, your mom, your neighbor, or your friend's wife can also be exposed to these difficulties. So you listening and asking for questions can be useful to other listeners as well who might not have the chance to call on directly. Those that wish to also contact us directly on the social medias can contact us from the Satiraman Health Group page on Facebook, or call on the clinic's number, which is also available on WhatsApp for those who are living outside the Gambia. The telephone number will be given to you at the end of this program. We also have illnesses that can easily cause the blockage of the fallopian tubes. A woman who has ectopic pregnancy, that's the pregnancy that grows outside the womb, because normally the pregnancy should grow from the inner part of the womb, but you have the eggs that sometimes are located in wrong places that makes them grow elsewhere outside the womb, because the womb, the part of the womb is the middle part. The womb is the middle part of your lower abdomen, but the side, the left and the right side, are the tubes that goes to the ovaries. So sometimes the eggs can be hidden there, it doesn't get to the womb, and you conceive by at that place. That causes ectopic pregnancy. And then well, that's when the egg develops itself in other places. And this is dangerous because painful and dangerous for the mother. That means the pregnancy will be on the side, not in the middle. It could be on the right or the left side of the abdomen. And usually it needs cases like surgery. And this can easily lead to complication of infertility in the future, because it easily causes an infection or inflammation of the tubes and cause the tube to get blocked, and or it also deform or injure the tubes. That's those ectopic pregnancy. And then surgical condition after ectopic pregnancy can lead to infertility, or abnormal growth of the child in the womb can also be some of the conditions. The moderator can pick the calls. Whenever there is a caller, you can now allow them to call, so that time will be given to others to also contribute if necessary. We also have birth defects, because if you have birth defects, like in delivery, that are complicated, it can also be the cause of many other conditions. It's very common with herpes, this which is an infection that infects a number of women usually, and then it makes their delivery to be short, like a premature delivery, and then doesn't allow the pregnancy to grow up to term. So there's a caller. Let's answer to this call. Hello. Okay. Because this could cause bleeding in the womb, in the body, and this lead to serious complications, and it causes also malformations of the cells in woman's body, so of the child as well. So we have so many infections that could be the causes of defects. But hello. Good, and you? Okay, thanks for listening. Thank you. With Dr. Satiraman, directly here from Star FM. As usual, this is your usual program that talks of your health, our health, and someone's health. These past 2 weeks, we've been having topics related to women's health and the causes of infertility with ladies. The previous one was what we call pelvic inflammatory diseases. We have observed that there are many cases of infertility that have been related to what we call PID, and which is an infection that usually takes place in the womb, in the uterus, where the baby develops, where the pregnancy grows from. And this happened to be one of the major causes of infertility these recent days. It has been affecting also teenagers who have not been married. So we have made clear to the public that PID, which are infection of the uterus of the Douglas and inner part of the womb, are related to untreated sexual transmittable infections, vaginal infection mostly. Vaginal infection that are not properly treated can lead to PID. It will inflame and infect the inner part of your womb. And recently, we have also discussed about what we call the 18 conditions that lead to infertility in ladies, because many ladies might be experiencing infertility cases. Some are related to sicknesses, some are congenital, some are even natural. So what are those conditions ladies need to know what need to be done to solve their problems? Last week we have the discussion and we've gone up to seven of the conditions. So we have promised you that we will also give you the other 11 parts, the 11 causes, for you to understand better these causes and the reasons. The incident here is that we have no Wolof and Mandinga interpreters due to reason beyond our control today, but we promise they will be here next week. But your questions can also be directed in Wolof or in Mandinga. We have people here who can easily help out, but it will be difficult to elaborate clearly this topic and this program in Wolof and Mandinga by myself. So I will do it in English. Thanks for listening. The number will be given to you later, but our moderator will kindly play the advert for you to have the clinic's telephone number for those who wish to call. Thank you. Exactly, that's very true.
So what you are saying is people don't know about the causes of fibroids in women.
Yes.
So what do you think can one be able to prevent their wife from getting fibroids?
Thank you. Thanks for your question. I will give you some tips about it. You can ring off and listen to this radio so that others can also benefit from your question. Thanks so much for your question.
Yeah, but is there any medical study for fibrosis, or what are the dangers of surgery?
Okay.
After whether you can able to get pregnant?
Okay, I will answer to all these questions. Thank you so much.
Yeah.
Thanks for your call. Thank you so much. Thanks to this listener, fibroid being a condition that is that which causes is today unknown. One of the causes of it, if I may say, would be congenital or hormonal. First of all, if you have a sister or a wife or a daughter who is from the family where ladies have been having fibroids, the risk of developing fibroid for that young person or for that lady is huge. Let's say 80%. So your question is that what can you do to prevent fibroids? There's numbers of conditions that might help you. Steps that you can take that will help you is to be eating healthy, taking a lot of fruits and vegetables. Stop taking alcohol for those who are alcoholic, because like I said, fibroid is not something that comes from elsewhere. It's not an strange body like an infection that grows in your body. No, it's the softened part in your womb that grows on its own. And constant medical examination to help you have a regular hormonal production. There's an hormone called estrogen that is a female hormone. If that estrogen production in a woman body, it is not balanced, is not produced as it should be, you can easily develop the fibroid. Control your blood pressure, because low blood pressure could also sometimes be one of its signs and symptoms. Get enough vitamins, that means eating well, especially vitamin D that makes your bones to be strong. That will also help you. And stay away from smokers. That means you that cause, if you are a smoker, avoid smoking, or you stop smoking around your daughters and your wife, and try to help them have a good eating habit. Because okay, I hope this answer was useful to you. Yes. Now the condition that you are asking to try to know what are the solution. There's always solution for a fibroid. The only condition is that if the fibroid is too big, it might be too late for the person because the womb will be taken out completely by a surgeon. Completely, yes. If it's very big and the womb is already defect and deformed, there won't be any use for the womb to remain there. It will be taken out. But if it is not very big, the person can be treated, and the fibroid sometimes can be treated or sometimes be taken out. It is not all cases of fibroid that need operation. But what is good about the fibroid, it is not something that can kill. It is not a cancer. It is a tumor, it is a mass, been there for a long time. If the person is already old, the thing can remain there if it doesn't disturb her, because on its own, if she's no more seeing her menstruation, her menses, this thing can shrink and go back to normal. Because it's one part of the womb that grows. It can go back to normal. But if she's a young lady that is at the age of having a baby, she needs to get herself treated. Visit us at Sati Raman Clinic around Bamunfati Junction here. Thank you so much. Thank you for your time. Alright, thank you. Thanks a lot to these listeners, because his question has been very enlightening, and then we want such questions. If you have any of such, please feel free to contact us directly on 788-6966, 788-6966, 900-966. For those that speak Madinga, Alfano say ate call okay, namanga pa masenya bake, but nani sa soto mingeta minsa sifati muso la karoto de wolo balia na yo pour sifa soto al se call okay kanyin ngaroke and say jabiro ke franke namanga ka masenya bake tu, but nza explain nyami Alfano sa understand nyam comme ku am febar bi tamet jigen ko amé dafa am jafe-jafe si wàllu am doom mun nga call si line bi tamit 788-6966 788-6966 wala 900-966 900-966. Programme bi pour jigéen la feebar yi ko amee dina mun a jàppa ñeneen jigéen ko amee mënut a wasin wala mënut a jël biir. Hello. Aleykum salaam wa rahmatullah. Alhamdulillah. Naa def ana waa kër bi. Waaw. 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 Okay, when I ku am dom, the first one.
No,
the second one. Koku dafa am dom. Okay, Sari Jobi, Munga Wanye Sari, can you off the radio for me to get your questions? I didn't get your question clearly because he has two wives, and one of them, according to him, has kids. I think the second one. And probably you might say the first one doesn't have a child. Is that the question? Yes. That's the question. Okay. As the husband, you should get the first person or the person among them, the second one who cannot give birth to a child, to visit a doctor. The patient can visit us at Sati Raman Clinic. We are here at Bamunfati Junction around Supaba. You might be having kids and suddenly stop having children. It's possible. Like I said, infections within your previous deliveries and this period might cause you not to become pregnant. Stress, a woman that has been giving you children, if she's under stress, if she's having depression, if your life has changed, if the family is really not happy, or if she is not treated the way she has been treated when she newly got married to you, she can have difficulties. She can experience difficulties from getting pregnant because she's depressed, she's not happy. The domestic work, if the woman works a lot at home, if she does a lot of work at home and at the same time she goes out to work, that causes hormonal imbalance. That means the eggs, our ovaries should be producing, will not be produced in number. The brain that need to release some substance, some vitamins to help the eggs to produce accordingly will not do so, and then she will not be able to get you a baby to give you a baby. In that case, you need to seek a medical advice, as we are doing now. You can visit us. We see to know exactly what's wrong with her. It might not be a disease condition. It might be socially related. If it's also a sickness, some tests and examination will be conducted to know the cause of it. But let me make it clear as well, sometimes the lady is also not the cause. We've seen cases whereby women will be giving birth, they are okay, things are fine. The man that has 2 or 3 wives will get an infection, or he might be using bicycles or rider, or might have a shock which will affect or suppress the testicles, because the testicle, the 2 eggs under, they are the one producing the sperm. And if there's any complication that affect your testicles sometime, it could be stress, it could be bicycle or any other thing, gym and so on. If you are going for gymnastics and your eggs might not be producing, or if you are somebody that have unprotected sex elsewhere or outside, that can also affect your testicles, and your eggs will stop producing. You might be active sexually, but the sperm you bring out might not contain what is needed, which are the spermatozoa, which should be from 40, 80 million to 300 million. If the eggs are not enough, your wife that womb was giving you babies will not be able to get pregnant anymore, and you might think she is the cause of the infertility. What you need to do as the husband, get yourself tested as well. Do a semen test. It is available here at Satiraman Clinic. If your sperm is tested, you will know if your sperm is at cause or not, and bring your wife or her to also be tested. I hope this answers has been helpful to you who call and those who are listening. If not, I am sorry I did not get your question clearly then. And then, do we have any other caller? Okay, no other caller, and we have only few less than 15 minutes left, so you can still call, because it is very important for you to know that other health conditions can lead to infertility. We also have women who, women generally are not equal. The womb of ladies have a position where they should be, and that position is a T position, but you have other ladies who have their womb that are in a V position. And if your womb is inverse, we call it retroverse uterus. Like the upper part is down and the down part is up. If your womb is inverse also, that reduces your chance of getting pregnant. And that is not a disease, that is not even curable. You are just born that way. And 40 to 30% of women in this world are having that type of womb, and that is not a disease, just that your chance of getting pregnant will be minimal. So this man who called, your wife who is not giving birth also might have a retroverse womb, that her womb is inverse and she's born that way. She doesn't need a surgery for that. She just needs to increase the hormones and the fertility chances. So if she visits us at Satiraman Clinic, I believe we should be able to help her out with hormonal treatment and so on, that will increase the chances on her side and also on your side as well. So this being the case, it is also important for one to control her diet, because the weight of a woman can also be an obstruction to conception. A woman who is overweight might be having miscarriages or might be experiencing hormonal imbalance, which will also be the cause of the infertility. She might be going to the hospital, she might be told there is no sickness, everything is fine, and she won't understand. She will then be going to the seers, the marabouts and so on, without knowing that the cause will only be the body mass, the body weight. Having a lot of mass in your abdomen, a big stomach, even after having a child, can sometimes prevent you from having other babies. So control your weight, control your diet, have a healthy living habit can also help you a lot. We also have what we call the cervix, that is the cord, the other part of the womb that hold the pregnancy. A lot and leads to some complications, but in most cases, infections, untreated infections. Like I said, some will not be going to the hospital, they will just be buying medication from here and there, and this medication might not treat or cure that infection, and they will keep buying medication until their cervix gets inflamed or seriously infected. we have a pragmatical example here to give to you. Each bacteria, each infection has a specific medications. This antibiotic you are seeing, they are from different categories. The antibiotic that can treat an infection here might not be effective in a different infections. That's the reason why you need to see a doctor, get yourself tested to know the type of infection you have and the type of antibiotic you might take. Your friend might use an antibiotic for a specific infection that she was suffering from that helps her to get a baby. You might not have that same infections. You might be infected with a different bacteria. If you don't get yourself tested to know what you are suffering from and you are getting the medication your friend took, it might complicate your case and make you experiencing serious difficulties. And at the end you might say, my friend used this medication and she got pregnant. Why am I not getting pregnant with that same medication? It's because your conditions are different. So this being the cases, these are what we can give to you as condition today. You can still call on 788-6966, 788-6966, 788-6966 or 900-966, 900-966. I would also like our moderator to also communicate these numbers in Wolof for the Wolof listeners, to ask them to call on this number in Wolof. You can quickly help. Okay, yes, well, you still have 5 minutes. Mun nga call si number bi so fekkee yaa ngi déglu suñu programme bi mun ok dafa mu nga am benn caller. Hello caller. Hello. Waaw jërëjëf naa def. Waaw dafa am fibroid. Okay. Okay, thank you for the call. You can drop your call now and listen to this, to continue listening to your radio. Thank you, Jerry Jeff. Somebody that has fibroid, who am fibroid, bleed red, fibroid bi mako cause. Because fibroid bi mun na nek fibroid bi mu ngi tok ci benen place bo amé waru ta nek fofu. So that the affect sa hormone bi, that the affect sa liggéey judekaay bi lu mu wara liggéey, that the affect lolu mun na nek judekaay bi mënut liggéey bu baax. Because dafa am ñaari nen bu nekk ci side jigéen benn ci right benn ci left nen bi dafa am tam bu mu war a ubbi di génne deret. So fibroid bi su nekkee foofu mun nañ jaxasoon liggéey nen bi mun na def liggéey boo amee baawut wala correctut. So deret bi mun na ñëwaat anytime wala mun na nekk fibroid dafa disrupt ci jullikaay bi tamit ba jullikaay bi dafa ubbi. So deret bi mu ngi ñëw ci loolu solution bi mu nekk garab dafa am ay garab boo amee kooku dina mun na naan pour deret bi bàyyi. But sometimes garab bi du mën a nekk solution ba nga génn fibroid bi because bu nekk foofu boo amee boobu mu nekk di cause problème bi bu nekk fibroid bi génnewuloo ko fajuloo ko deret bi du mun a bàyyee si boppam. Dafa am garab mun na la jóg garab wala pengu wala per koo amee kooku dafa war a rof si biir su ko defee deret bi dina bàyyee ba si kanam ba duggee dina mun a ñëwaat because fibroid bi daf di rëy daf di continuer di màgget di rëy. So solution bi moo nekk génne fibroid bi su fekkee dafa rëy su fekkee dafa tuuti nga faj ko. Mun nga call si suñu lamba gannaaw after programme bi mun nga call directly ñu jóg la suñu direction su bëggee ñëw foofu ñu dimbale la. Téléphone l'hôpital bi mu nekk 714-5169 714-5169 wala 98-38-545 98-38-545 or 38-37077 38-37077. Satira man pini mu ngi fi ba mun fati bori Supaba si kaw tali bi mu ngi fofu be legi demagun ci new location bi. So minto tajama sia bake nala ka call ke mola number to clinic la number to alsimi number call 714-5169 714-5169 wala kita Satira man clinic la number ti wala 98-38-545 98-38-545 Satira man be nyingula to ba mun fati junction ani Supaba man jam fa bake Supamba ani Westfield fana man jam fa bake ni mo Supaba lo mo be gi lungu tene lungu fo dimanche kadati talan sey so manda fo wularu So nali chances soto alsi nanja wala alsi kolo ke ni nambato. Next week fana mo be na la jam and inshallah chances be soto la kanyu jamo be for maninga ka ni suraka na bake because be momo soto jam minsi mo manko ni kawoto. Ala barka bake. Thanks for your time. Thanks for listening. The advert will be coming on again for you to get an information about this program and our current location. Thanks for your time.